This is just a quick companion case. Basically, this was a young female, and they had this lesion here, and you can barely see it. So there's already a clue here about what it might be because it's very, very similar to liver. This was the arterial phase, and this was the more delayed phase. You can see it's got this pretty homogeneous blush on the arterial phase and pretty iso-intense on the delayed. So Amr is saying FNH, and that is what we thought this was. There was a central scar here. Sometimes it looks like it might be washing out a tiny bit, but that's usually because it's displacing vessels and it's slightly disorganized tissue. It's not exactly like the liver. The confusing part about this case was that there was some dropout on the outer phase here, and compared to the in phase where it just completely blended in with the liver. So what do you guys think? Do you think it's still an FNH, even though it has some fat in it?
Was your central scar T2 bright? And I didn't really see it late enhancing.
It's not very T2 bright, but we did see a suggestion of a central scar on the post-contrast right here. Yeah, so Susan Asher has got it. So it says, yes, and Anu also. So FNH can have fat. So this ended up getting resected because it was called, potentially an adenoma because of the fat. So just one quick teaching point about that is that FNHs are disorganized liver proliferation, usually in reaction to a vascular malformation. So usually the vascular malformation is the central scar part, and you get this disorganized proliferation here. And you can usually see it best on the arterial phase. 40% will have a central scar. They have this homogeneous arterial blush, and they become iso-intense on all other phases. So sometimes you might not see it, and you might just see it splaying vessels. And 95% will retain eovist because they have OATP transporters. So this is just a nice example of an FNH versus an adenoma. The FNH arterial enhanced became iso, and then on the, I guess I didn't, this isn't working, but and it retained contrast on the eovist. This adenoma, which was washing out, did not retain contrast, so that's often how we can differentiate. Although, as I just mentioned, some adenomas can retain eovist. And then finally, the point is that FNHs can have fat. So this was from the French group in European Radiology. They compared resected FNHs with fat compared to adenomas with fat. And their conclusion was that fat within a typical FNH should not reduce your diagnostic confidence that this is an FNH. So if you think that it's an FNH, but it happens to have some fat in it, don't reduce your diagnostic confidence, and you can work it up either with an eovist or possibly a biopsy. And as Steve said, all rules are not absolutes. Yes. So don't forget that some FNHs can have fat.
Okay. This patient didn't have a hepatobiliary phase, right?
No, unfortunately, no. And that would have been the next thing in the workup, I think, is to do an hepatobiliary phase. But I think we got thrown off by the fat and just, thought it was an adenoma.